Brenda? Yes. Thank you.
Good afternoon. Many of you were involved in it. In 2005, Georgia passed a comprehensive tort reform legislation which was known as Senate Bill number 3. So we're going to start today by saying what happened since that time. There was a lot of work for you. It was a big deal. So what happened since that time? Since that time, there's been a 30% decrease in the number of medical malpractice cases in this state. There's been a stabilization of the payments that go out for those cases. Before the 5 years before that bill was passed, the compensation was increasing about 9% per year. Since that time, it is absolutely stable, and we have had a slated decrease in medical malpractice charges on the books. And then there was a little problem about what about the constitutionality of this legislation. And as you well know, the state's Supreme Court struck down the cap on non-economic damages in March of last year. Now, the question is, why is that important? And the first thing I want you to consider is that tort legislation that you passed that important? Does it really matter? And I think a very interesting place to look is Texas. Because Texas had a very similar tort legislation package. And they passed it a little earlier than we did in 2003. But they had exactly the same experience, similar laws, same experience in their state. They decreased the number of their medical malpractice cases by 50%. They decreased the claims by 33%. And since it has persisted, for doctors in that state, 90% of them have seen a 30% decrease in their medical malpractice rates. That's important. Consequently, the number of docs in Texas has increased, and also the number of insurance options, meaning the number of insurance companies that go in and do competitive bidding, has increased in Texas. So clearly, we know what tort reform legislation can do. It has done that in a number of states. What I want you to consider is what tort legislation cannot do. And I say that it does not improve the quality of health care. It's not cost effective. It doesn't reliably help patients who are harmed, and it certainly does nothing to retrain or get rid of bad doctors. The basis for those comments come from some large studies that have been done. The first one was done in 1974. And this was a study where they went in, they pulled records from hospitals, and they said, okay, we've had this many admissions to this facility. How many times was there a serious doctor error? And the results were, in 1994, there was a 1% significant injury due to medical negligence. We repeated another study. This was done in New York in 1984, 1%. Serious medical errors created in that study. Repeated in 1992 in both Utah and California, and you see a trend here. 1% of all admissions to hospitals have significant errors that are due to medical negligence. But during that same time period, there's not been a stabilization of the cost of medical malpractice. In fact, there's been a 1,642% increase in the cost of money that we spent in the tort liability system. So that means we've had over 1,000 times increased cost with no improvement. According to MAG, the tort settlement patterns basically go in favor of docs. In Georgia last year, 91% of the cases that went to trial settled in favor of the doctor. Historically, 84% of the cases, all cases brought in Georgia, are settled without any money being paid to the patient. And AMA confirms that this number is true nationwide. But even though that money doesn't go to the patient, there's still costs involved with it. If you looked at just cases dropped, that means never going to court, that costs on an average, and this is 2008 dollars, it's more now, $12 $22,000. If the doctor wins, it's $1,100. But if the patient succeeds in a charge, do they get a lot of money? Actually, they get maybe less than 50% of the money that's in the settlement. Across this nation, in settlements, the cost to try the case, the legal cost, the administrative cost, are from 54 to 60% of the amount of money that is settled for. So, if it goes to case, is that a good way to decide if there was wrongdoing or not? There was a lovely little study done about a year ago where they looked at cases from several across this country's insurance companies and said, okay, here are the cases that have been settled. Were they settled in the right way? And they found that in 37% of the time, there was no doctor error. So that means in 2/3 of the cases they looked at, there was a doctor error. In 3% of the cases, there wasn't even a problem. They couldn't verify that there was a problem. But when you looked at those cases, here's the important point. If there was a medical error, that means the doctor did actual medical negligence and there was an error, only 73% of the time was the patient compensated. If there was no error, 72% of the time they didn't get any compensation, but if there was no error, still 28% of the time the patient got compensated. A very unreliable way to make sure that when patients are damaged, that they actually get some help that they need. Now, again, the cost issue. Pricewaterhouse estimates that it's 10% of our medical bill nationally is because of the charges for medical liability. And here's the important point, because this is the main part we're going to talk to about today. Robert Wood Johnson's Foundation says that when you're looking at medical malpractice insurance, the most important thing to control cost is the cap on non-economic damages. And that's the thing that we have just removed from our Georgia system. If you look at those states where they had cap on non-economic damages, the decrease in the insurance rates, as you can see here, for internal medicine is 17.3%, general surgery 20%, OBGYN 25%. That's across the nation. Cap on non-economic damages is the most important point in controlling costs. If you look at insurance rates, why that's important for Georgia is it has to do mostly with the rural areas, not the suburban areas. And I realize that most of our docs are in the suburban areas, but we have a huge rural area here in Georgia. And every time there's a 10% increase in insurance rates, there's a 1% increase in docs, 1% decrease in docs, I'm so sorry. And that's very important for me as a gynecologist, because already we have 50 counties in Georgia with absolutely no full-time OBGYN care. So we really need to make sure that we control medical malpractice insurance rates. So my point for me being here as a doc is what we are looking at when we are looking at the medical malpractice, or the medical errors being handled in the tort system. We have an enormously expensive, very unreliable, almost capricious system to take care of patients that does nothing for overall medical quality and is not attached directly to get rid of bad docs or even retraining bad docs. And in these difficult times, when we're all looking at spending our money wisely, we want to make sure that even though this is a difficult topic, that we look at it again. And that's why we're here today. And for all of us on the panel, we welcome you.